Hello, Daniel Dahdah from St Jude's Clinic, and I'm sharing with you some information on what's called a sagittal deformity, or in plain language, a side view deformity. You can see how this man in here has got an exaggerated thoracic bump, kyphosis, Sherman's disease, and you can see here that given some treatment, how that angle or that change in his deformity is quite obvious to the eye. No x-ray required, but x-rays were taken, and he's gone from 110 down to the 80s now in terms of his degrees. Here's another lady as well with a different type of increased bump in her back as well. A flattened lower back, an increased thoracic kyphosis with a forward head carriage, whereas this fella has an increased lumbar lordosis, and this lady has no lumbar lordosis. So there are two different types of deformities, two different types of strategies, non-surgical strategies for actually helping people recover. And you can see them there again with the naked eye. You don't need an x-ray to be able to see these changes. Some of these people are quite old. The lady before was 86, this one's 82. And the changes can be made, again, no lumbar lordosis in here. Whereas in the first case, an exaggerated lumbar lordosis. And you can see then changes are occurring fairly quickly, non-surgical changes, and that's exciting. Let's take a look again at a progressive one in here. Again, an increased lumbar curvature, increased thoracic curvature, and again, the changes can be seen. This is more a adolescent scoliosis in here, and you can see again that there's asymmetry between the arms hanging from one side, the shoulder heights, the shoulder blades, and the veering of the body over to one side there as well. Again, this is what it looks like when you're bending forwards. Okay, so this is that unsightly bump that takes place. Okay, and that's what it looks like. All right, let's get to the literature now in here. Okay, so this is basically taking a look at, this paper is by Dr. Justin Shear from the US. Thanks, Dr. Justin, for posting this in June 2021. It's looking at the side view, the sagittal deformity, with a follow-up of a minimum 2 years here. Now, we need to take a look at the facts to see what conclusions can be made. And whilst there will be changes with surgery, like I've shown you with these patients, there will be changes. We need to find out at what cost the changes are occurring. And so 74.6% of patients had at least one complication. That's 3 in every 4. It's a high complication rate, at least one. 1 in 10 of them, or say 1 in 9 of them, because it's 11%, had 4 or more complications. And surgeons do an amazing job when required if there was no alternative. But I believe that we can actually demonstrate alternatives. 1 in 3 of these people at follow-up after 2 years or more had a minimum of 1 major complication, and 3 in every 10 had actually further revision surgery. So again, this paper is from 2021. So that's the sort of, I guess, option that people are given to non-surgical procedures here as well. And these are the non-surgical outcomes. And there's no complications at all with these procedures here. They are low risk, they are low dose radiation, they are fast outcomes, and they can be demonstrated consecutively as well. So I'd like to present a good news story here as well. There are actually non-surgical rates, non-bracing alternatives towards helping people with either the increased lumbar lordosis, increased thoracic kyphosis, or the no lumbar lordosis, increased thoracic kyphosis. So there is a reason why the trends for spinal fusion surgery is on the increase, and I want you in particular to take a look at the videos that I've made on screens, and also how to get rid of pain in the neck as well, using some simple strategies. My name's Daniel Dahdah, I'm from St Jude's Clinic, and I look forward to sharing an empowering model of care that does deliver results. Thank you for watching.